Hey, all right. It is Monday, so I'm going on Facebook Live to do another session of Ask the Doc. Tonight, we're going to be talking about how to treat headaches yourself and how to get rid of them if you get them frequently or you've been getting them. Now, this can be a pretty complicated thing, and I just figured, though, it was a good topic, especially because for those of you, today's Monday, no one likes going to work, everyone gets stressed, and that stress can definitely lead to a headache and some neck pain and all of that. Not to mention, for those of you, if you didn't see yesterday, the New England Patriots won and are going back to the Super Bowl. So that relieves a lot of pressure. I enjoy watching them and watching Tom Brady go back again 9 times in 17 years. But I know a lot of you don't, and a lot of you, that created a lot of stress and anger, and that's all built up, and it's going right to your neck, shoulders, and head, and just creating that pounding headache, and where you might get, some visual issues, and it just can really be incapacitating. So thanks everyone for watching. Hey Shanna, hey Tim, thanks for watching. So Shanna says boo. She is not a fan of apparently Tom Brady or the New England Patriots, but so Shanna might have a headache today after watching that game yesterday. That was a heck of a game. Going into headaches though, and headaches can be very complicated. So this is definitely a subject that you shouldn't take lightly and shouldn't just necessarily continue to put it off if you continue to get them. You need to seek the help of a healthcare professional and try not to necessarily just go and self-diagnose. It can be a number of things that could be causing the headaches. Just on a serious note, it can be cancer. It could be a brain tumor. It could be some ischemic attack like a stroke, or could be a number of things. So first and foremost, I suggest you talking with a healthcare professional, doing my due diligence there. Hey, Aunt Katie, how's it going? But what I see a lot of people come into my clinic for with headaches is related to the neck, so the cervical spine and the muscles around it. So with that, a lot of times when you get some dysfunction there, it can manifest in a number of different ways. And the good thing is, though, is that physical therapy and certain exercises and manual therapy techniques have been shown to be beneficial and can help it. So with that being said, I get a lot of people coming in with excruciating headaches, and a lot of people describe these headaches a lot of times as migraines. And the reason they say it's migraines is because everyone just uses the term migraine when they have a headache that really can be pretty intense. And migraines are intense. They're extremely intense. If you're getting sensitive to light and sound and throwing up, vomiting, chances are that's a pretty good migraine you got going on there. But just because you get an intense headache doesn't necessarily make it a migraine. There's a number of different types of headaches out there. And so going from there, if it is coming from the neck, there are some different exercises you can do. And the other thing that helps is manual therapy to help relieve. Thanks for the like there, Jess. Hey, Matt. Hey, Cheyenne. So one of the things that you can do is go and get some manual therapy from a physical therapist. You could go see a massage therapist if you find that they help. But that manual therapy, whether it's massage, whether it's whatever works for you, dry needling, joint mobilization, everyone's a little bit different. A lot of times you're going to be really stiff through these upper cervical spine right there, and getting those joints loosened up and moving appropriately can really help to decrease some of that tension, improve your range of motion, decrease stress, and just improve the function to help take away that headache. So once you get the manual therapy and you get everything loosened up with certain stretches and certain techniques, then you can also use some self stretches to help maintain what was just achieved with manual therapy techniques, because everyone wants someone else to fix them. Well, manual therapy techniques really can last anywhere from, I tell people, a few hours to a few days, but a lot of times it's not necessarily going to fix you, and you really need something else to help drive long-term change and correct the issue or the problem area that is causing the headaches. So with a lot of people, it is postural stability. So, and it can be how you sit, how you do things every day. Are you at a computer screen every day? Just some brief tips there with a computer screen. Make sure that it's at eye level if you're sitting up nice and tall, feet are flat on the floor, and it can even be a little slightly above eye level. Make sure you're not constantly looking down. So I'm guilty of this with my little scooter desk that I have around in the clinic, of being hunched over and my head's forward like this. And if I were there for a significant period of time, yeah, it's going to bug me. Now, bad posture, though, we can go into that. That's a whole other topic, just because you can't walk around stiff the whole time either. You need to be able to move in and out of certain postures. Whether it's good posture or bad posture, you need to be able to move in and move out of it. The spine is meant to move, so get it moving. Exercise is a great stress reliever and a way to control those headaches as well. So there are certain exercises you can do. So if you are still watching and you want to know what some of those exercises are that I use with my patients, that can be pretty beneficial. I got a couple of them that I'd be willing to share with you. You just need to comment in the comments below, just comment headache, and I will send you a link to get those exercises. And so that way you can try to use those to help manage your headaches. But again, if you're having them, I do strongly recommend get in, see a physical therapist, see your physician, talk to them about your headaches, make sure this is appropriate and it's not something more serious. I would hate for you to, think that it's just something really light and then you push it off and it is something more serious. So that is something to take very seriously and not fool around with if you are getting intense headaches and you've been getting them. So comment though below headaches if you want to see those stretches, those exercises that can help give you relief. And that way you don't have to be taking those medications that you're constantly taking, and instead you're doing something safe and something efficient, something that your body is meant to be doing, because you're going to be fixing some of those problem areas that likely occur in those people with headaches. And if you also want to jump on a video call with me independently, one-on-one, we can also go over some of the signs and symptoms that you have and help treat you. So I do video sessions. That is another option. But if you want those exercises, I recommend comment below. I'm more than happy to help you. Just comment headaches. I'll personal message you and send you those, and hopefully that will help you out. So if anyone has any questions, feel free, drop them in the comments below, and I'd be happy to, again, answer any questions you have, whether it's headaches or anything else, whether it's to help with also some stress management techniques. If you're going to be really stressed out for the next 2 weeks because you know that Tom Brady's going to win another Super Bowl MVP, I know that drives some people insane. I love watching greatness and watching the best of our era and the best of all time do it though. So thanks so much for watching if you have watched this far. And I hope to see you guys. I will see you guys again next Monday. Stay tuned on what we will be talking about and covering. It will be a new topic. So thanks again for watching, everyone. Have a great night.